Hello everyone, I'm called Dr. Miru Musa. I'm a gynecologist practicing at Henrob Hospital. I'm usually at Henrob Hospital on Saturdays from 8 to 5 p.m. So this month of January is the Cervical Cancer Awareness Month. And I'm here to talk about cervical cancer, prevention of cervical cancer. Worldwide, cervical cancer is the number 4 killer among the women. And in Uganda, West Africa, and in Uganda per se, cervical cancer ranked second in the cancer burdens. And the reason why we are still ranking second is because we are not preventing cervical cancer in Uganda. Cervical cancer is preventable because 99% of cervical cancer is caused by an infection called HPV virus. And this HPV, once or when it infects you, it takes 10 years from the period of inoculation or infection to the period of developing cervical cancer. So meaning that it gives us a very long grace period where we can come in and intervene and prevent the development of cervical cancer. There are so many strategies, and one of the strategies of preventing cervical cancer, one is preventing infection with the HPV virus, and that is by vaccination. The government of Uganda, with the support from WHO, has brought vaccines in Uganda, vaccines against cervical cancer. And this vaccine targets young girls from the age of 8 years to 21 years. At Henrob Hospital, we can vaccinate these girls against cervical cancer. And any other hospital, any other public hospitals, they do have these vaccines. Please let us take our daughters to get this vaccine, and this will help us from getting cervical cancer. The other strategy we have is screening against cervical cancer. We do screen at Henrob Hospital and all government hospitals. We do screen against cervical cancer. The screening is in 4 modalities. I want to emphasize the HPV screening, because most of the time before, women are not coming to us, and we're saying that when they come to us for screening, that we put an instrument or a speculum into their private parts and it's painful. Now there's a new screening modality called HPV DNA testing. Here, we don't insert anything into your vagina. We don't insert the instrument into your vagina. Rather, we give you a small probe, which you yourself insert into your vagina or into your private parts, and then we pick a sample, which you then hand over to us, and we go and test it to see if you are infected with HPV virus. If you have the infection, we then can go ahead and treat you. We treat that infection, and this will prevent you from getting the cervical cancer. We screen mothers from the age of 25 years up to 65 years. That's a screening age group. However, if a mother has never been screened, or if a woman has never been screened at 70 or after 65 years, they are still eligible for screening. The screening intervals is every 5 years. We screen you once in 5 years' time. So honestly, my dear sisters, my dear mothers, and my dear daughters, we can prevent cervical cancer by simply screening. So we are asking you in this month of Cervical Cancer Awareness Month, this month of January, please come to Henrob Hospital or to any other government hospital and ask to be screened against cervical cancer. Unfortunately, when you get HPV virus, you will never get any symptom or any sign to show that you have the infection. So that's why you should do the screening routinely. You don't have to wait for any sign, because you are not going to get any sign. The first sign you're going to get that you have HPV infection is when you have the cancer. So let us screen against cervical cancer. Let us work together, and let us prevent and let us eliminate cervical cancer. Thank you very much.